Hello, my name is Karen Donoughe. I'm a licensed professional counselor and chief of the Adult Psychological Assessment Program at the Rochester Center for Behavioral Medicine. Psychological screening is a process undertaken to assist clinicians in determining an accurate diagnosis. Oftentimes, reported symptoms can be associated with many different disorders. At RCBM, we do our best to reach an accurate diagnosis. Careful screening allows this to happen. With an accurate diagnosis, appropriate treatment can be efficiently implemented. The screening process is typically administered in 3 stages. In the first stage, the patient will meet with the clinician to review the presenting concerns. During this time, the clinician may verbally administer some assessments. In the second stage, the patient will be seated at a desk and asked to complete several written assessments. The third stage requires the patient to complete computer-administered assessments. The entire screening process takes between 2 and 4 hours, depending on the individual's pace. Parents will be involved in the assessment process if we are evaluating a child or adolescent. For many of our adult patients, the input of spouses is useful. The results allow us to recognize clinical diagnoses such as depression, anxiety, certain sleep disturbances, and ADHD. Intelligence, cognitive functioning, learning disabilities, and personality issues can also be ascertained. In addition to psychological screening, we also perform educational testing at the Rochester Center for Behavioral Medicine. Educational testing is required when an individual with ADHD or a learning disability is seeking special accommodations at their school or work setting. We work within the guidelines established by the agencies, administering the ACT, SATs, GREs, LSATs, and MCATs. Accommodations may include extended test time, obtaining the right to take standardized tests in quieter rooms, and any number of aids designed to help achieve success in their academic and workplace endeavors. Educational testing takes between 4 and 6 hours, again depending on the pace of the patient. Accommodations are legally protected rights, and my colleague Kathy Pritchard discusses this at greater length in her video about school advocacy and accommodations. Once the assessment process has been completed, a detailed report will be written and shared personally with the referring clinician, usually Dr. Young or one of our psychiatric nurse practitioners. These results guide the development of a treatment plan, including whether or which type of medication is selected. The patient receives a copy of the report, and in the case of educational testing, the School or Testing Bureau receives the documentation necessary to decide the request for accommodations. It is important to note that psychological assessment and educational testing may not be covered by health insurance. It is the patient's responsibility to call and verify coverage of assessment with their individual company. Our front office staff can assist you in this effort. I and the staff at RCBM look forward to meeting and working with you.